Greetings and welcome to another Cleveland Public Library, the Next 400 monthly digital discussion panel. Chris Tanaka from 19 News, your moderator as always. Tonight we have two incredible guests. I can't wait to get to them, but first the topic and how we arrived at the choice for this month. April is Minority Health Month. There's always a focus on improving the lives of minority men and women in our community here in Northeast Ohio and really across the country because so many disparities occur and continue. We also wanted to fold in a layer not just of medical, physical, physiological health, but also mental health as well. We all remember seeing Will Smith slap Chris Rock on stage at the Oscars. The repercussions of it across society and pop culture were felt for weeks, and there continue to be valid discussions about it, what those actions were, what they represented, and how we can overcome them. So tonight we're going to be looking a lot at not only health, minority health, but stereotypes of Black masculinity and how that can have a ripple effect and health some detrimental aspects of health. So right now our guest, Dr. Charles Modlin from MetroHealth Medical Center. He is the founder of the Minority Men's Health Fair. That will be happening in just a couple days. We're going to talk about that soon enough. And Dr. William Ajayi, he'll be going by Will casually for this discussion. He's a mental health specialist for Google. Gentlemen, thank you both for joining us tonight. You can go ahead and unmute your mics as we hop right into it. Will, I'd like to start with you. First, a welcome and thanks for being here. But let's tackle these stereotypes of Black masculinity that are so pervasive in our society. Can you explain what they are and how they really hem in a lot of young Black men today?
Sure, and thank you so much, Chris, for having myself and Dr. Modlin for this really important discussion. I think it's a really complex issue, and it manifests in a lot of very, very fascinating, interesting, but somewhat disturbing ways, right? I think one of the easiest ways to think about this is thinking about the word stigma and how that shows up, right? In relation to masculinity and the stereotypes. I think the first place to start is really ask ourselves, like, what are the stereotypes that we think of when we think of Black men in general? What's the first image? What comes to mind, right? There's a narrative out there that's been present for decades, truly, that sort of depicts Black men as aggressive, inherently aggressive, or hypersexual, or violent, or out of control, right? Or sort of this animalistic experience. And so that's sort of the base layer or the framing that we might go into thinking about stereotypes associated with Black men. How does that then impact everything else? How does that impact the sort of social determinants of health that we think about today? How is that impacted if the underlying narrative is something pretty deplorable? So I think those stereotypes can manifest in interesting ways. One of the, I'm a clinician, right, by trade. So one of the things that I see and I've experienced personally is sort of the stereotype about strength and not displaying any weakness. What does that mean? How does that show up? What are the implications? Where did that come from? Why is that such a valued piece of information, right? And how does it manifest as it relates to mental health or physical health, social health, financial health? This notion of not displaying weakness because it means I'm vulnerable. And I think if you look at sort of the implications of a statement like that, and the experience of that, and watching the folks in the community have experiences in which they've expressed some level of vulnerability and paid the consequences for it, it sort of stands to reason that young boys, Black boys watching this learn pretty quickly. No, you have to be strong. You need to be quiet. You need to keep to yourself. You have to operate by a particular set of rules in order to survive and potentially thrive. So I think it's a large, huge, amorphous question. Yeah. It manifests in really, really interesting ways. But I think we have to look at the basis of where this comes from.
But it's interesting. You say this invulnerability, displaying this invulnerability, and Dr. Modlin has been really making it his life's passion to say it's not only okay to be vulnerable, but we are all vulnerable. And we're vulnerable against things we can't see, things we can't control, and gaining a measure of strength is really in addressing these vulnerabilities. Doctor, when you see first-timers come into your minority men's health fair, do you hear these refrains? Is it common for you to see gentlemen who come in perhaps not wanting to be there and not express their own vulnerabilities?
And thank you for having me part of this panel discussion. And again, this is a very difficult subject matter, very, very complicated. As was indicated, to your question, we started the Minority Men's Health Fair at Cleveland Clinic back in 2003. And the first year we held the health fair, we had only about 35 men show up. And it really took a number of years of doing the health fair before we actually realized expansive numbers. I think part of the issue was it took us a while to become part of the community, because I'm actually not from Cleveland, and it took us a while to really study what were some of the reservations or fears that were actually keeping men from making the decision or from being empowered to come in themselves and get preventative health screenings for their own benefit. A lot of the disease states that we see that especially African-American men of color are more prone to developing chronic disease states such as diabetes, hypertension, kidney disease, heart disease, twice the incidence of developing prostate cancer and dying for prostate cancer. All of these healthcare disparities result in about a 4 to 6 shorter life expectancy in Black men compared to their white male counterparts. And it wasn't until we really developed a clear understanding, studied the issue, were we able to implement community outreach initiatives designed to better educate and engage and build trusting relationships within the community, to where the men would actually feel more comfortable coming in to undergo these preventative health examinations, again, for their own benefit. And a lot of it had to do with what has happened in the past, egregious actions committed, for example, by the hands of the United States Public Health Service. The Tuskegee syphilis experiment and other egregious actions have actually been internalized and affected the behaviors of men, their behaviors, their attitudes, and their practice patterns in terms of even going in to get a simple health check. So it's a complex problem. We need to devote more attention to it, but we need to demonstrate to the community that we understand what their fears are, what their distrust is, the background, the reasoning for their distrust. And we need to be empathetic to that, but we actually have to also design more effective ways in which to not only engage them, but keep them within the system, and recognizing that there are a number of social determinants of health that actually have negatively impacted their ability to access the system. To your question, I wanted to show you one quick article from Drexel University. I don't know so it talks about how doctors' biases mean that Black men don't get the same treatment in healthcare. This is a scientific study that demonstrated that implicit biases of doctors and healthcare providers lead to poor communication between the doctor and the patient in their interactions, and a lot of stereotyping on the part of healthcare providers, to where they feel that a lot of men of color, for example, don't care about their health. That there are a lot of men of color, they're not going to be compliant with their treatment recommendations. And that leads to a greater disinterest on the part of the healthcare provider. It shouldn't, but I mean, again, these are the findings, the stark findings. In many situations, it leads to a disinterest on the part of the healthcare providers in serving men of color. So it's a complex problem. I'm glad that we're broaching the subject today, and a lot more work needs to be done about this.
Yeah, and Will, I'd imagine in your line of work, you see these effects exacerbate themselves in ways that are not just medical, correct?
Absolutely.
Yeah.
I think Dr. Modlin's very sobering sort of synopsis of the state of affairs is very clear. And those biases there, the structural sort of experience, right, that Black men have, and this goes beyond just Black men. I know we're focusing on that as a topic today, but just the Black experience in general is this sort of devaluation or misattribution of what the symptoms might mean, right? So, and to Dr. Modlin's point about the impact of implicit bias, absolutely, it shows up. It shows up outside of the hospital system, shows up outside of the therapist's office because it exists. And I think it manifests in ways that might surprise a lot of clinicians and a lot of providers. So really, I think level setting is about acknowledging the realities first. And I've followed Dr. Modlin's work for the last 15 years. And sort of level setting and acknowledging there's distrust. Yes, there's fear. This is based on reality. Oftentimes we skip that step, right? We jump into solutioning and figure out how do we solve the problem, but we have to start with acknowledging the problem and that acknowledging that the problem exists alive and well today before we can start to truly solution on it. To the point in terms of my work as a clinician this past 10 years, or 10 to 12 years, it shows up in the therapist office as well, right? I mentioned that word stigma in terms of, Black folks don't need therapy. Black folks don't go to therapy. Black men who have been sort of taught by societal expectations and the biases that exist in stereotyping that being weak equals, or being vulnerable equals being weak. So that is a liability. Don't do that. And then you think about sort of the structural experience of having a sort of a mental health condition within certain communities, right? In the Black community, for a very, very long time, this is not something we discussed, right? This isn't something that's acceptable. This is something that is not spoke about openly. Therefore, the sort of structural support doesn't exist in the same way necessarily for some folks. So there's a lot of isolation. So people are suffering in silence. They're experiencing just a plethora of physical conditions. There are plenty of correlational studies that look at mental health difficulties in conjunction with physical health difficulties and their comorbid conditions. So folks suffer in silence given the nature of what permissions they have to be able to acknowledge that they're in pain. So I think these worlds absolutely intersect. And oftentimes I can think of a couple of experiences or examples in which working with an African-American male client, and the first several sessions are, testing. Can I trust you? Do you understand my experience? Do you believe me? Do you think, because there's a lot of misdiagnosis, particularly earlier on in mental health, where a lot of African-American males in particular were disproportionately diagnosed with very, very significant severe conditions of psychosis, when it's really a representation of something else, depression, but they're sort of diagnosed with psychosis, which has an incredibly huge stigma and follows folks and can cause a lot of difficulties having that level of misdiagnosis in terms of treatment intervention. So there are real consequences for implicit bias, like Dr. Modlin mentioned. There are absolutely real consequences for that internalized stigma of I cannot demonstrate vulnerability. If I do, something bad's going to happen. So those are parts of the complexity of this. So I'm really glad we're having this conversation about bringing some of these things to light.
You said something that fascinates me, and I'd like to ask a personal question of each of you, and in the meantime, maybe expose my own naivete. You mentioned, Will, when clients come to see you, them feeling you out to see if they can trust you. And Dr. Modlin said this on a large scope when he began his health fair, and I'm sure he gets some of that today. Like I said, exposing my own naivete, I would assume that men would come in and recognize that, okay, maybe you are someone I can trust because you're not, some old white guy who's going to prejudge me. Is that a sign? Are you saying that's how deep this is? That it's institutional more than personal?
I think you're raising a really, really, really important point. There's so much complexity in the Black experience, right? Just because of the color of my skin, right? It doesn't necessarily mean that we're going to have similar experiences.
Yeah.
And so, and in the therapeutic environment, it's such an intimate, personal relationship that, before I reveal anything, I need to make sure that you understand. I need to make sure that you care. I need to make sure that you're not one of them, which I get a lot. You're either too young or you smile too much or there's something going on that makes you separate. So I can't necessarily trust you. So it takes time to fill that out. And I think that's really, really important. I think given the nature of the work, and it's a personal experience, we should all, right, be feeling folks out and making sure that that connection is real, because the nature of the work that requires going really, really deep. But it does happen. Again, I mean, there've been sort of the term Uncle Tom comes to mind for me, actually. in terms of thinking about like, are you one of them? Are you one of the system? Are you going to treat me in the same way that I've been treated? And I explained to folks a lot that just because of the way I look and you look, it doesn't mean we're going to jive. I think, okay, we found a match so we can get you in the door. Awesome, fantastic. But we still have to have a real relationship. Otherwise, this isn't going to work. So and that I think is again how stereotypes can manifest externally, right? The fear of being viewed as weak. And if you think about it in this term, I'm a Black man, right? If Dr. Modlin came in and we were having a sort of professional relationship, right? I'm gonna be your therapist, Dr. Modlin, if that's okay, just for a minute. And he came in, right? We look similar, so he's walked in the door. We found each other, and it's fantastic. Now, if he says to me, if for him something's coming up internally, like, oh, I can't demonstrate weakness because that's not something we do in our community, but I'm in front of someone who looks like me, how do I work through that, right? That internalized stigma within the context of a therapeutic relationship, right? So that's an additional barrier that sort of can potentially be invisible, but it absolutely exists. So it's really important to kind of test the waters and make sure that that connection is real and genuine before folks feel comfortable moving forward.
Wow.
Yeah. I think, to your point and to your question, Chris, just being African-American physician therapist is not enough to engender the trust, with either individuals or the community at large. As I indicated, I'm not originally from Cleveland. I've been here now close to 29 years. But one thing I found out when I was building the Minority Men's Health Fair, my Minority Men's Health Center, is that I actually had to get endorsement and buy-in from respected leaders in the community before I could actually really develop the trusting relationship that was necessary. I mean, people such as Reverend Dr. Cavanis, Reverend, Dr. Otis Moss, Dr. McMickle, Reverend Dr. Larry Macon. These are just some individuals that I had to prove myself to these individuals before they would actually endorse the programming that I actually had developed. It wasn't until we received that endorsement, that stamp of approval. And again, I understand why it's important because, just being a Black doctor, having a Black face and putting on a white coat really isn't sufficient to gain the trust from the community. I in fact, of course, I'm not going to name names, but I've actually seen patients, Black patients who saw previously other Black physicians, and then they wanted to transfer their care to me because they didn't really have an adequate patient experience from those physicians. One way in which, we are held to a higher standard almost in a certain perspective by the Black community, because as physicians, there are very few of us. Only about 4% of the physicians in the United States are African American, about 6% Hispanic Latino. And because of that, when we go out into the community, there's a certain expectation that we are going to be purveyors or watchdogs of the community in terms of helping promote access to care, healthcare education. We're always looked at and looked up to, filling those shoes, that mantle. So it's not the situation where we can just go to work, do our job at the hospital and then go home. We're on display at all times, and we have to live up to that expectation because we have actually been fortunate enough to have been able to receive a medical education. There are many talented individuals who never really have that ability. I feel blessed myself to have been able to acquire a medical education. My father and my mother taught me at a very early age that it's my responsibility to use the education that I was fortunate enough to receive to give back to the community. My father told me when I was very young, he said, nobody cares about Black men. And it didn't really resonate with me when I was younger, but as I grew and had lived experiences, I understood what he was saying. So I've internalized this. This is a calling for me, that it's really my responsibility to do this work and to do what I can to improve the health of the community. I have my father's picture here, Charles Modlin Sr., and I recognize him every time I speak because he's my inspiration, and he's where I get the resiliency that I need to continue doing this work despite a number of obstacles, roadblocks, oppositions. He's the one that allows me to stay focused and continue to move forward in the work that I know needs to be done.
Yeah, that is remarkable. One thing that popped into my mind, and I digress just for a moment before I ask my next question, is I'm preparing to deliver a speech for NASA during AAPI Heritage Month. And the topic is advancing leadership through collaboration. And one of the examples I cite is this generational schism between Asian populations, where I'd say Gen X and older, or perhaps just immigrants or sons and daughters of immigrants, see each other with national and ethnic and cultural barriers, where this beautiful generation of younger Asian Americans, younger millennials and Gen Zers coming up, really have responded to this wave of hate attacks with this togetherness and this camaraderie that has never existed before, where there isn't this mistrust between countries. So when I asked that first question, you guys first, were describing your experiences so authentically and genuinely, which I thank you for. It triggered that thought in my mind that said, gosh, different populace, similar experiences as far as, that potential for distrust. Getting back on topic, let me throw this at you. When so many of these detrimental stereotypes are put upon Black men and manifest themselves then within individuals, how do you break the cycle? How do you not become what other people think of you?
So, powerful question, Chris. I don't know how much time we have. We might need to book some.
I'm fascinated. I love listening to both of you gentlemen. So take as much time as you need.
That's wow. I think it's such a thoughtful question. In my experience, I think education is critical, and I don't mean necessarily formulaic education. I mean just education about the history of, for instance, where stereotypes come from. What is this stigma thing I've heard so much about? How does it actually manifest in my world, right? Personally, I really think education from a trusted source is crucial to be able to start the conversation about making change. As I've said before, there are a lot of people doing a lot of incredible work, and access is an issue. Access as a starting point in terms of where do we begin this conversation? When do we, like Dr. Modlin said, with references from his father, right? When was this implicit message communicated? And then what space did it have to grow into the work that's developed after, all these years later? When are we having these conversations with kids, right? With our young boys, to talk about vulnerability, to talk about like the purpose of fear, to talk about what is stigma, what's that internalized feeling, to talk about emotions in general, what they mean, how to process them, why they're there. Where does it truly start? I think it starts with folks in trusted positions being open, honest, and vulnerable about the realities on the ground. I think it starts with leveraging the experiences. I mean, you think about the last couple of years, several years, and the glorification of just the violence that we've seen against Black men, against Black people in the media. And that's a reality that's been happening for a long time. As horrific as these images are, as horrendous as this is, there's also been an incredible opportunity to have real level set conversations about the reality. I choose to involve my children in some of these conversations so that they're aware, right? Most parents, right? Most parents of Black children have some conversations like this, especially with their boys, about just some of the realities that exist. And it impacts a lot in terms of certain behaviors. It impacts how you present yourself. It impacts a lot of things about awareness of the environment. There are conversations happening across the world where parents are having these conversations with their kids, and it's sad, it's unfortunate, but it's the reality. And I would rather prepare my children, the people that I care for the realities, and then teach them with scaffolding how to take care of themselves, how to stand up for each other, how to create a safe environment for themselves wherever they go, so that if and when these issues present themselves, they're armed with awareness and with the education of how to deal with this. They're also armed with the freedom to connect with the emotions that are real and genuine, even when you're 3, right? Connect with those emotions and recognize that they're real, but not let that turn you into the thing that folks are saying that you are.
Yeah.
So I think, again, a complex question, but it starts with, what are we teaching our kids about vulnerability, about emotion, about honesty, about how we're doing? What are we teaching? What are we saying is acceptable in society in terms of how we treat the people who look differently from us? And I think that's a message that goes across race, across culture, across context.
Absolutely. And certainly when people are able to reach out for help, when they seek help, there's a sense of self-empowerment, of taking your own destiny into your own hands. I'd like to bounce back to Dr. Modlin on this. If you will, you don't need to name names, but I wonder how many first-timers to the men's health fair enter reticent and skeptical, but return empowered.
Yeah, and actually that's what I consider the measure of success of our health fair. You know, some people say, well, it's the total number who show up. To me, it's not the total number, 5,000, 3, whatever. It's the fact that these men have made the decision to attend the health fair, to undergo these preventative health screenings. They understand the importance of undergoing the screenings. Nobody is forcing them to come. They're coming on their own volition. And so just having the men show up to the event, also success is measured by the fact that we have a number of like-minded healthcare providers at MetroHealth. And when I was at the clinic, we had like-minded healthcare providers. We have over 500 healthcare providers already lined up and ready to serve the individuals that come to the health fair this Thursday. And again, every healthcare provider at MetroHealth is educated around unconscious biases, implicit bias, cultural competency, and they understand what these individuals. Again, not to stereotype, everybody has a different lived experience, but we understand that there are a number of individuals who have suffered disproportionately from a number of social determinants of health, and so we know it's not just laying on of hands in terms of addressing the physical manifestations of disease. We actually have to get to the root causes. MetroHealth actually has an entire social determinants of health institute. It's called the Institute for Hope, which actually is a full-time institute addressing the factors associated with the social determinants of health. I think what was mentioned, I think we have to also understand when we're talking about negative stereotypes, we have to educate our young people in terms of where a lot of these stereotypes originated. And we have to work with our young people so that they will understand their self-worth, because unfortunately, even subconsciously, a lot of our young people have internalized what has been told to them by society, that they're intellectually inferior, they're lazy, they don't have the capacity to achieve certain goals compared to other individuals in society. And if you grow up thinking that way, if you have a lot of self-doubt, the chances that you're going to succeed or even be aspirational are much less. So we have to change the mindset. We have to go back into history. We're talking about the next 400. Unfortunately, we have to go back and talk about the first 400 also to explain this. I think one way which we're going to combat this also is to demonstrate to our young people and show them examples of successful Black males. We're talking tonight about Black males, but obviously, Black females, people of color, and speak to them about how they've achieved their successes. I actually wrote a whole book. I'm not here trying to sell my book to the audience, but I'm just demonstrating I've dedicated a lot of my career to mentoring and advising our youth. But I actually wrote a whole book geared towards success tips and success navigation pathways for our young people. So I wholeheartedly believe that it's our responsibility, the older generation, to help change the mindset, to improve the self-esteem of individuals. This is so disturbing. We're seeing increased rates of suicide at levels never seen before in our adolescents of color, even down to the age of 5 years old. And a lot of it is the negative stereotypes that they're hearing throughout social media has really negatively impacted the mindset of our young children. We need to get our children in many situations off of this social media. But again, we have to remain stoic. We have to remain strong. We have to remain persistent to continue this fight to change these negative stereotypes. Very important.
Yeah. Will, you're nodding.
Yeah, I just taking in the wisdom that Dr. Modlin is sharing with us. I think it's absolutely built into society and how things, the first 400, how have things evolved since then, and have we truly unpacked the consequences of that, right? Direct and indirect, unintended consequences, and how does that show up today still, right? I mean, there is unfortunately a narrative that is not positive, right? Particularly for Black men. And, before Black men are Black men, they're Black boys. And I think that's a really good place to target. I think we have to start there and start to change the nature of the conversation and that stereotype, because once it's internalized, it's incredibly difficult. It takes a lot of work to unpack that and to dismantle that structural sort of pillar foundation of who I am as a person and what I'm able to achieve compared to what I'm not.
Yeah.
And I think, it's a multi-pronged approach for sure, but that education piece and the awareness and kind of level setting at the younger age is crucial, because so much of our personality development, just taking a step back, like personality development occurs pretty early. It's formative. And the things we learn when we were young, we tend to keep those things very, very firm in memory, and they impact subsequent decisions. If I learn that I'm only going to make it this far, right, and this is the ceiling for me, that's what I'm going to shoot for, right? If I don't have access to folks who've gone beyond this, if I don't understand that I have the innate capacity to do whatever I want, if I don't understand that that's part of my experience, or if it isn't part of my experience, then that's the problem. That's where the structural sort of decapitation of these young boys begins. And then, yes, they grow up into be men who are then viewed as violent, dangerous, right? That's part of the sort of unfortunate conversation. So I believe I have a limited cognitive capacity. I believe X, Y, Z things about myself. Society is telling me all of this information about what I'm capable of. It makes it very, very difficult to battle that internalized stigma, because the message is everywhere. So I just agree a lot with what we're discussing today. I think it is multifaceted, but I am to not paint too much of a grim picture. I am really, really impressed with the work that's happening today. Right? There's a level of openness about having some of these conversations that has not existed in my experience professionally. There's a lot of interest in starting to open the door, or the window even, to be able to give folks permission to share about their lived experience without that level of criticism and judgment that has existed in the past. I'm seeing growing opportunities for Black men specifically to be vulnerable, and also have that not be equated with being weak, and actually have that sort of reconceptualized as a strength to be able to talk about the realities that they're facing. So I am noticing some trends in a different direction. It doesn't mean we don't have work to do, but there's more permission to be honest, it seems, and direct about the experience that I've ever seen professionally or personally. So I think that's something. We're definitely moving in the right direction, but it requires tremendous scaffolding. It requires institutional support. It requires the anti-stigma campaign to continue. It requires a lot of work on all our parts to make these types of conversations normative.
Yeah.
Yeah, I'll say I'm a little bit disturbed, actually a lot disturbed in some of what I see is going on in society in terms of a lot of racial anxiety that has been created in terms of labeling everybody quote unquote racist. That disturbs me, because in a lot of what I've been reading and studying and trying to understand this subject matter, I see that, and there's studies to back this up, that labeling or creating a lot of racial anxiety actually can backfire on the intended outcomes. And one example is students are oftentimes less challenged. Black students are oftentimes less challenged by their teachers, because their teachers don't want to be labeled as racist by challenging them. The students need to be challenged.
Yeah.
Very, very important. My mother was actually an elementary grade school teacher, and that gave me certain advantages, but she was right on me. She actually had a lot of expectations that she placed upon me. My father did also. So we have to continue challenging our students, and research has shown a lot of teachers just look the other way, and especially a lot of Black males are invisible to a lot of their teachers, and they just fall through the cracks and through the system. They just pass them from grade to grade without ever challenging them, and that's not doing them any good. So, again, it's a complex subject, but we have to understand that we have to work together as a society. These racial divides are not doing anybody any good,
Right.
At all. So this is a complex problem, but we have to come together and solve this together.
Yeah, absolutely. Dr. Modlin, I want to make sure people know about the Minority Men's Health Fair that's coming up. So can you please give the particulars? I know it's Thursday. 19 News is going to be out there for our viewing audience, but for our streaming audience, can you give the details right now?
So yes, thank you. So 2 days from now, Thursday, April the 28th, between the hours of 5 p.m. and 8:30 p.m., we're going to be holding our MetroHealth Minority Men's Health Fair. It's a free opportunity for men to come in, free parking for free preventative health screenings. We're going to be drawing blood. We're going to be having health examinations, evaluations. We're actually having essentially every medical specialty on hand, so the men can actually get free consultations and healthcare evaluations, receive health information. We have nearly 100 outside social services organizations to provide their information to the men. We're going to actually have this health fair in 3 simultaneous MetroHealth locations. We're going to be at our main campus, which is 2500 MetroHealth Drive. We're going to be specifically in the outpatient pavilion. We're going to be at our Broadway location, and then the address of that is 6835 Broadway Avenue. It's over in Slavic Village. And we're going to be at our Cleveland Heights location across from the Home Depot, 10 Severance Circle. All of these are occurring simultaneously. You don't have to pre-register. You can just walk on in on the day of the event. We're going to get you in and take care of you. This is an opportunity of a lifetime. Again, like I said, a lot of men mistakenly think that they have to have signs, symptoms, pain, discomfort to have a number of serious conditions, and that's not true. So come on in. It's painless. We're here to welcome you, and we want you to take advantage of this opportunity.
Absolutely. And as men take care of their medical health, Will, let me throw the last word to you. What are some ways people can work in their daily lives, nuts and bolts ways, to kind of improve themselves a little bit every single day? What would your advice be?
Great question, Chris. I think a lot of things, but
Sure.
If I could distill, I guess, my thoughts down, I think the conversations that we have on a day-to-day basis that occur between our ears are probably the most important ones, right? So essentially, what I tell myself about me really does matter, right? And I think we have this critical voice that shows up in moments of pain, frustration, suffering, failure, disappointment. And that voice tends to maybe start it off externally. Like, I didn't start off saying this to myself, but I heard that message from my parents, my community, society, and now I've internalized that message, and it shows up during these moments of suffering. So a day-to-day task I would encourage our viewers and anyone who's connected here to really just think about what you're saying to you about you as it relates to anything, right? Your relationships, your health, your mental health, whatever. What are you saying to you about you? And it doesn't matter if it's right or wrong. That's totally irrelevant. The real question that matters is what I'm saying to me about me helpful for me right now? And if there's any doubt that it isn't, that's a sign that it's time to try something different. I might just be simply being compassionate and kind to yourself in the moment, but to do something else, to say something else, because what I'm saying to myself right now that I've said for 30 years, 35 years, maybe isn't super helpful. That would be my sort of nuts and bolts takeaway to that question, Chris. Thank you.
Well, as you both said, it's not just a conversation. It's a huge, multifaceted issue that needs to be put on the front burner, needs to be talked about, and needs to be actioned. And in some little way, hopefully we accomplish something tonight for some of our viewers out there, even if it's just learning or if it's validating. And I thank you both, because these conversations are not only important, but they really are fascinating. And they're fascinating because you each share authentically yourselves, your experiences, and your wisdom. So for everyone who watched and our partners at the Cleveland Public Library and here at 19 News, Dr. Modlin, great to see you again. Thank you as always, sir. We'll be out there for the Minority Men's Health Fair on Thursday. And Dr. William Ajayi, who's a mental health specialist at Google, thank you so much for volunteering your time. Michael Young at the library sings your praises, and certainly just marveled at listening to you tonight. So, gentlemen, thank you both for joining us this evening.
Thank you.
Thank you so much, Chris. Thank you for the opportunity.
All right, and everyone, you can watch this in perpetuity on the Cleveland Public Library's Facebook page. Have a good evening.